Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring in another in our series of interviews with top leaders in health IT. And our guests today are Dr. Tim O'Connell, co-founder and CEO at Emtelligent, and Dr. Paulo Pinho, chief medical and strategy officer at Discern Health. Welcome, guys.
Thanks, John. It's a pleasure to be here.
Yeah,
thanks for having us.
Excited for the discussion, but before we dive in today, maybe you could start us off. Tell us a little bit about yourself and Emtelligent.
Sounds great. Thank you. I'm based in Vancouver. I'm a practicing radiologist. I work 1 to 2 days a week clinically and spend the rest of my time with the team at Intelligent. Founded in 2016, and we're a medical AI company. People have chart data, we extract it, make it usable, and work with people on really fun and interesting use cases.
Interesting. Paulo, how about yourself and Discern Health?
So I'm also a physician, board certified internal medicine and pediatrics, practiced full-time until about 2016, still practice part-time, but have really moved out into the health tech space with a company called Discern Health. We essentially are taking clinical data, claims data, social data, and really using it to drive predictive modeling to sort of prevent and predict poor clinical outcomes in high-risk individuals. So,
Very
grab us.
Well, I appreciate having two doctors here to educate me. I love having doctors involved in this AI that's happening, the NLP that's happening. So, maybe you could start us off, Tim. Some in the industry talk about medical NLP and how it's fallen short. I mean, I think it's kind of having its heyday right now.
Yep.
But talk to us about historically why it has been problematic and hasn't, reached its full realization.
For sure. I think a lot of people have thought about it like fusion energy. It's, 20 years away from the last 50 years.
Yeah, it'd be nice one day.
Yeah, and, really, the revolution for all things machine learning happened in 2009 when sort of deep learning came on the scene. And ever since then, the accuracy rates, particularly for, medical language understanding, have really started to go up. And so there actually have been great products now on the marketplace for several years, but the COVID pandemic really did slow things down for implementation. So now the health systems, we both have these deep learning based systems for medical data extraction, and now we've got generative AI involved as well. And they serve really unique and useful and complementary roles. And so now that the pandemic's over, people are really excited about these technologies and they're starting to implement them now.
Interesting. Paulo, what would you add? What's been your experience in seeing this evolution of NLP?
I mean, I think there's a lot of technology. Healthcare is one of these, sort of historically legacy thinking, kind of disciplines. There's a comfort level that medical providers have with probabilism, but it's their own probabilism. I think when it's probabilism created by a machine, there's sort of a concern about it. I also think that the way documentation happens in clinical notes tends to be a mixture of both the structured data that's required for transaction of administrative aspects of healthcare, billing and coding and things like that, and then all of this rich information that kind of gets put in a little bit more ad hoc with a different physician and provider flair every time that someone else documents it. And I think some of the challenges with NLP have been around attribution, right? Is it that person's risk or is it their family member's risk? Negation, is this not, as opposed to a true. And so I think that those have been some of the biggest challenges. Medical knowledge too it's not black and white, right? There's a lot of shades of gray. Even things like, what does CP mean, right? That's cerebral palsy versus what does CP mean if you're a cardiologist, right? And so just the vernacular of healthcare makes it a little bit challenging. I think, as Tim had suggested, the technologies have definitely improved. And I think it's a really promising era for NLP and AI in general in healthcare because of that.
Yeah. No, I mean, you highlight so many important nuances to the challenge that we're faced. But Tim, how do you think AI has kind of changed this narrative, and how is Emtelligent taking advantage of these new innovations to kind of move us forward to, because to his point, for some reason we want AI to be perfect when humans aren't perfect, but but we need this technology because people are burnt out, et cetera. So talk about what you're doing there with AI.
Absolutely. So we have sort of two main products or platforms. One is a large-scale data extraction engine, and you can feed it millions of patient records and it can extract the meaning, it codes the documents, it understands things like negation and ambiguity and uncertainty and relations between things. The white cell count was 14, right? It will link those together and So it takes that data out and stores it in a very structured way so that people can use it for many use cases. But this week, we've launched our medical large language models. And what that does is it gives people an interface to these databases of, massive databases of millions of documents so that people can interact with them in a really sort of meaningful and complex way. For example, someone like Paula's team might be like, does the patient have coronary artery disease? If so, how many blood vessels are affected? Has the patient had stents? How many vessels have been stented, and what vessels are they? You can literally just write that into our interface, and it will go to the database and retrieve that information for you. So it really solves a lot of the really complex analytics, payer, technology company, health system use cases, and we're really excited about it.
So ChatGPT doesn't do that?
You know what? The rising tide lifts all boats. But we really seem to have solved a lot of the issues around hallucinations and things like that. And we've sort of taken it to medical school so that it will understand in context that CP could be cerebral palsy or it could be chest pain.
Yeah. It kind of reminds me of the early evolution of, voice recognition.
Yes.
It did great when you were talking about your family,
Yeah.
but when you start saying myocarditis, like this, or I'm not a doctor, obviously,
Sure.
but then it's like,
That was good, though.
It screws.
It was good.
Yeah, that's interesting.
And the only thing I'd add too is I think that one of the great things about Tim's team is they're really about explainability. There's a lot of attention paid to that. The codification of concepts that come in an unstructured format and really kind of bubble up so that they can be used and transacted for different use cases is huge. I also think that they understand that their solution isn't a point solution, right? It's because of the grays that exist with medicine. There needs to be that explainability. You need to have an explainability when you're engaging a prospect, but you also need to have an ongoing sort of client success journey that holds that client's hand through the entire process, because that's the problem with a lot of these solutions. If there's not continue finding the appropriate stakeholders and internally bringing on new ones, holding them through the process, these become great technologies that become abandoned, right?
Yeah.
And I think they've been really thoughtful in how they've approached that.
Well, let's talk about that explainability, because it is such an important concept. Because, I remember a doctor saying, when I went into med school, I thought for sure I'd see these data and then here's what I should do. And you realize, wait, the science isn't solved on a lot of things. So, is it providing the data to allow, you to research more, or, explain more about, how you're approaching explainability? Maybe you can chime in.
Sure, John. And so explainability has been built into our product suite since day one, because I think it's really important as a physician. I really don't want a machine making a decision on my behalf. What I want is a machine to present me as a clinician with the data, and then I can confirm, you're right. Yeah, let's go ahead with this plan. And so our software will always, when it extracts something, it will go, here's what I found, here's the sentence I found it in, doctor, you make the decision here. And even our large language model now is highly explainable. It can reference things to medical ontologies, and it can also reference things back to source documents and sentences, so that really it's about putting the right data in front of the caregiver at the point of care at the time they need it, so that they can make the decision they need safely.
Interesting. So where are you seeing these innovations being applied across healthcare? Providers, payers, pharma, life sciences? Maybe you could start.
Yeah, I mean, I think the reality of it is that you have a lot of end users. You have these, medical providers that are documenting things in their own way with their own electronic health record systems, in their own vernacular and abbreviations and stuff like that. But you need payers to really look into this for things like risk adjustment. They have to be able to look at these, documents and determine the severity based on things that aren't necessarily codified. Even some quality measures, et cetera. Pharmaceutical industries, as they start, clinical trials that are determining things like inclusion criteria, exclusion criteria, or doing post-market surveillance need this. I think the federal government from a utilization standpoint, state governments from a utilization standpoint, need to be able to get into those, clinical documents and start to pull that very rich information out. And then you need to be able to transact care, right? And it's not, and if you've ever read notes that are void of all the adjectives and adverbs that come associated with the descriptors that are codified, and you're just looking at those the codified elements, it doesn't really tell a story, right? You don't get insight into what that other provider was thinking about when they ordered this test or when they prescribed this medication. The nuance is really in this unstructured text, right? So making that pop is really of value to, providers, to payers, to the public health system, to policymakers. All of that's really important because those are end users that are expecting this voluminous data to tell the full story, but all they get is sort of just pieces of it, right? And they then have to synthesize those pieces and abstract some concepts themselves. This is a way to kind of guide them through without as much abstraction, as much human error, et cetera. And that's why I think it's important.
Interesting. What else would you add? And maybe talk about some of the benefits they're receiving from it, cost savings, revenue. How do you measure the benefits?
Absolutely. The only other thing I would add would certainly be life sciences. Real world evidence are certainly areas where we have some amazing drugs now, but they are very expensive, as deservedly so, for some of the technology that went into developing these drugs. And payers need ongoing evidence that this drug is providing benefit to the patient. And so that has to come from chart data. And so extracting that and getting it in front of the person and justifying that treatment is really important. And other use cases, certainly at a show like this, there's a lot of health tech companies here, and they don't necessarily want to become language experts. And they just may have one fairly narrow use case, and we're happy to work with people like that to bake the product into their product and use data in efficient and useful ways. In terms of measuring it, I'm a really big believer that you need to have measurable outcomes when you're implementing new technologies, right? It needs to be an ROI for it. It can't just be based on vibes.
And it's gotten even more so, I think.
And it's gotten even more so now.
Organizations are stretched for cash.
Absolutely. And so I think it needs to be quantifiable. If you're building an application for clinicians, it either has to, measurably improve patient safety, or it has to measurably improve the efficiency of care, right? Reduce caregiver burnout or improve patient throughput, things like that. So I think it's all about how you design the process.
Yeah, and I think the other piece of it is that there's no industry like healthcare where you have people working, where they should be working top of their license. They're really working on solving some of these very, transactable, concepts. Instead of having providers think and make decisions based on the abundance of evidence that's provided to them, a lot of times they're doing chart abstraction, and that happens in every space, in every industry that we mentioned. I think the other thing that's really frustrating to me as a healthcare provider, but also someone who's seen my family consume healthcare, is that patients have to be the porters of their own information. So you go to a primary care doctor and they refer you to a specialist, and that conversation with the specialist is basically starting from scratch and retelling your story, but telling it from the perspective that you have, right? And I think that there's a bias when you ask a patient to kind of explain things. And you see this where, you may be referred to a pulmonologist because of the fact that you have shortness of breath, for example, but there may be things in your gastrointestinal symptoms and your neurologic symptoms that are really pointing towards a diagnosis. You don't know that as a patient as to whether or not they're important, right? But if you put in the hands of that specialist the data, you're obviating the need for a patient who doesn't know, who isn't medically literate. And by the way, a lot of people who are very literate or not necessarily medically literate, they don't have to tell the story because the story actually pops from the way the data has been abstracted out of these clinical notes. And that's hugely important for how we deliver better outcomes.
Yeah. It's always interesting when a chronic patient gets a chronic disease and discovers that doesn't happen automatically. We look at interoperability and we're like, well, will the patient like it? It's like, no, most patients assume that's what's happening.
Yeah.
So they don't have to do it. But it's not, right?
Yeah.
In many cases. Let's look a little forward, right? Where do you see NLP and kind of more broadly medical AI going next? Maybe you can start and then Tim.
Oh, yeah. So, I think, look, the reality of it is that, every technology that's existed in medicine has had issues with adoption, right? I mean, we look back to Linac and the stethoscope. It's not like everyone just started using the stethoscope, right off the bat. There's an adoption, like providers were listening to it and thinking to themselves, like, I don't understand what I'm hearing. This is a very weird thing. Or this invasive concept of actually putting a piece of metal on someone's chest that, patients observing that. And, there was a learning curve that needed to happen. You had, a social divide where people that were the haves maybe had a medical provider, a physician that had access to this, and the have-nots maybe did not have access to this. And so there was an adoption. It didn't universally just happen. I think that what we're seeing in conferences like this are certainly, charging me up in terms of, what's happening. I think providers are realizing that this is becoming the next wave of tools that's going to be part of their medical black bag, which I think is hugely important, right? And I think as we get clearer on explainability, as we start to explain that this is not here to replace you, but this is here to just augment the work that you're doing, I think that you're going to get broader adoption from providers. I see medical education changing as we start, incorporating more of this, and that's a requirement. So medical schools and residency programs will include this. I mean, look, I even see the field of health informatics evolving. I remember when I was certifying for meaningful use, like finding people that were like-minded was a really big challenge. And maybe I hang out with cooler people now, and so maybe that's more of a possibility. But I think there's more of us that are, dually trained in the technology aspects of care delivery, as well as the high tech and the high touch aspects of care delivery, and that's what I think is changing now, and I think that's very promising for a future that's adopting this as a very meaningful tool for care delivery.
Nice. I like that idea. What's in your medical AI black bag? That's cool.
Totally. Yeah, I really think that human augmentation is the promise of AI, right? I'm a radiologist, and everyone's like, "Oh, are you scared they're going to take your job away?" And you know what? The AI is going to make the most frustrating part of my job, the detection tasks, get a lot easier and safer and better for patients. And it's going to lead me to doing more of the things that I enjoy, the higher level thinking, the actual diagnosing, and the patient consulting and the patient procedures. Right. And so, and we're going to see that across the healthcare spectrum, right? There's so many algorithms that clinicians use today. In fact, there's too many, I think, really for all of us to remember, oh gosh, I've got this patient that meets these criteria. Which algorithm should I use? Right. That's a great use case for AI, being able to take this huge view of all the information in the patient's chart and go, oh, hey, doctor, right? Here's some of the things you should consider. And here's the evidence that tells me that you should consider this, right? And then the doctor can go away and do the higher level cognition tasks and the patient communication tasks and, holding the patient's hand and walking them through, their care journey. I think that's going to be really important, and spending less time charting, searching the chart, right? Recording blood work, rewriting documents, looking at the last discharge summary and redictating part of it because it was the same type of admission, this sort of thing, right? We need better tools to do our jobs more efficiently, safer, and better.
It's interesting because so many doctors are like, why did the EMR make our lives worse?
Right.
And my answer is because we required more of you. We needed more data from you. And it feels like medical AI and ambient voice and all these technologies that are doing what you described, which is it's doing what technology should have done for healthcare, which is automate the tasks that nobody wants to do.
Yeah.
So initially we demanded more, but now we're going to fill that demand, which is still needed, but do it in an automated way. So that's what
hopefully. I think there's this trough of sort of like that happened. EHRs were a very necessary thing, and I'm glad that they're here, and they've provided tremendous benefit to patients, but it changed physician workflows for the worse in many cases. And I think now AI are going to be the tools that bring physicians back to better than where they were before.
Yeah. And it builds on itself. I think, as we look at, you can't run, predictive models on my end, for example, without having a clean input, coming in, right? And if you're only getting part of the puzzle, in structured data, that unstructured data is necessary to start to paint that full picture. And so I think we're really building a connected ecosystem of best of breed solutions that are gonna really revolutionize the way care is provided, and do so at a time when there's a huge supply-demand mismatch, right? We have increasing provider attrition. We have a growing needs in the population. We have novel technologies, novel biomarkers and genetic tests that need to have that explainability. It's really through these kind of collaborations that happens, and that's fostered in the most productive way.
Yeah, absolutely. Tim, Paulo, this was fascinating and a great look at what's happening and how AI is really impacting healthcare. So I appreciate you taking time to talk to us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, guys.
Thank you.
Thank you, John. Goodbye.